Hi, I would like to give a brief introduction about medical transcription course conducted by Chemmanur Academy. Chemmanur is a very well-known business group in South India, mainly into retail jewelry trade. We have operations in India and abroad, and as a group, we are more than 100 years old. Chemmanur got into the field of education in 2002 by starting Chemmanur Academy. Chemmanur Academy introduced medical transcription training in 2004 with an association with the #1 MT company in India, that is HealthScribe. And over the years, we have trained more than 1,500 MTs and had a placement record of more than 90%. Currently, we are doing online training for medical transcription, and we have a faculty to assist all the trainees. The complete material is sent. It's a medical transcription home training kit is sent to the candidate once the candidate enrolls for the program. And there will be a weekly follow-up of the training by the MT faculty. After the training, yes, there will be an assessment and certificate is also provided. Now, what is medical transcription? It's a very interesting career, and it's a career that will always move with you wherever you go. So wherever there is medical insurance, there is always a requirement for medical transcriptionists. So it does not matter which country. It could be US or Canada, Australia or UK. Wherever there is medical insurance, there is a requirement for medical transcriptionists. In fact, Chemmanur is also into training of nurses for their various licensure exams. And many of our nurses, before they go abroad, they do medical transcription course and then they go abroad, because it's always a secondary income. We have a lot of nurses who get audio files from various clinics in Canada and Canada in the US, and they transcribe these audio files and get paid by the clinic. So it is always looked as like a secondary career. And we have a number of nurses who is looking at medical transcription as a first career also. Now, this evolution of transcription, it dates back to 1960s. Okay, so wherever there are hospitals, wherever there are requirement for medical insurance, MTs will always get a job. So if you can type 50 words per minute, yes, you can be an MT. Okay, and you have like 65 characters in one line. The most important aspects of medical transcription is, one is accuracy, correctness of the words in a line. And then second is productivity. That means the maximum number of lines that you're able to produce. The minimum eligibility requirement to be a medical transcriptionist is English language, okay, especially written English. You will be trained on medical terminologies. Yes, you will eventually learn, typing skills. And one of the main requirements is concentration and patience. But yes, you do not require medical background to do medical transcription. Even a 12th standard pass is good enough to pick up the skills for medical transcription. Now, what is medical transcription? A medical transcription process starts when a doctor is dictating a patient's medical history. So when a patient comes to see a doctor, the doctor will observe the patients, and the conversation that happens between the patient is dictated into a dictaphone, which is recorded, saved into a server, and the medical transcription is listening to this audio file and converting it into a written format. Now, the dictation is normally done on a recording device, or it is done on a dictaphone. And nowadays, many doctors, they dial a toll-free number, and then they give the dictation, which is saved into a server, and the medical transcription service provider uses these audio files, gives it to a medical transcriptionist who converts it into a written format. Now, this medical transcription, it comes under the healthcare BPO sector. And why is India one of the main destinations for medical transcription? It is mainly, one is the time zone. We have the perfect night and day time zone, especially when it comes to US. But yes, we get files not only from the US, you get from Canada, you can get from Australia, you can get from UK. Another big reason is the low labor cost. Okay, a medical transcriptionist costs 4 times or 5 times in regard to salary compared to a medical transcriptionist who's working from India. So there is huge cost saving for MT companies when they send their audio files to come to countries like India, where it can be done at a very low cost. And India has got highly skilled workforce. It has got a very good English-speaking population and good broadband connectivity. So that is why India is one of the best destinations for receiving medical transcription audio files. Yes, it's an excellent career. There are a lot of skills that you pick up when you do medical transcription. One of the main skills is you improve on your English comprehension skills, your listening skills. You pick up on multiple accents because, if you're getting files from Australia, it's a different accent. You're getting files from the US, it's a different accent. And you pick up on your typing skills, you pick up on medical terminologies, and you also learn how to do medical report formats. Now, a medical transcriptionist is that person who converts the medical audio file into a written format. The next level of career progression is a medical transcription editor. So if you have done medical transcription for 5 years or so, you can now become a medical editor. The salaries for medical editors are very high, literally double than what an MT also would earn. And what does an editor do? Corrects and edits the reports generated by the medical transcriptionist. Okay. Now, a very brief process. Yes, the audio files which are saved into a server goes to a medical transcriptionist who will listen and convert into a typewritten format. Then it is quality checked by the medical editor. It goes to the doctor's office, and that report is submitted for medical insurance claims. So this is what medical transcriptionist does. So reports on the history, medical history, consultation, operative reports, discharge summaries, clinical notes of the doctors, chart notes, radiology reports, autopsy reports. So these are the various kind of reports an MT does. So what are the skills that an MT has? So we already discussed this: basic English grammar skills, listening comprehension skills, typing skills, knowledge of medical terms, formatting guidelines, and yes, you need a lot of concentration and patience to do medical transcription. Benefits of medical transcription. One of the biggest benefits is work from home, and it has become so relevant because of today's pandemic. You don't have to travel anywhere. The audio files are sent to you at your home, and you have to convert them into a typewritten format. And you have flexible hours. Yes, you're given so much of work per day, and you have a deadline within which you need to complete it, and you need to upload the files. So this is one career which is 100% work from home. And nowadays, what MTs are doing is they are promoting their services in various online sites, and many MTs are getting directly work from clinics in the US, where they do the work for the clinic and upload the files once the work is done. So this is the only career where you have flexible hours. You can, you get time with your family. You don't have to go by train or bus anywhere. And, you can get salary plus incentive per line, or you can just, work on incentives per line. And it is an interesting career. Yes, there is job security. If you're a good medical transcriptionist, you're always in demand. You can work from a hospital also. Now, here in Kerala, we have multiple hospitals that are actually taking medical transcriptionists because medical insurance requirements is increasing in India also. And even in the Middle East, there are now large requirements for MTs that is coming up in the Middle East. Who will want to hire you? Yes, 80% of MTs do work from home. And then you have medical transcription service companies who will hire you, hospitals, clinics will hire you, physician offices will hire you, insurance companies will hire you. So what are you waiting for? Think of this as a career, And you can contact our office. This is our address and our phone number. Our email ID is also provided. You can also look into our website and all the details are given. We have two programs. One is just the medical transcription home training kit. It is self-learning kit where you just have to take the kit and you have to do the work every day for at least 4 hours, 4 to 5 hours. You have to keep practicing. And if you need online assistance, yes, we have a faculty. So these are two different products. One is if you want the home transcription kit alone, that costs about 10,000 rupees. And with an online faculty, that would cost 20,000 rupees. So think about this as a career where you can work from home. And yes, it is very relevant due to the pandemic today. Thank you.